Hello and welcome back to GP Video Podcast by Nadia. So today the condition that I'm going to start talking about is called endometriosis. I'm sure many women have heard about this term and know a little bit about it here and there, but I am going to produce a series of podcasts on this topic only because it is a very important topic, a very common condition, but is extremely underdiagnosed and something that we all need awareness about. So, my heading of this podcast or the title of this podcast would be Painful Periods. Think about endometriosis. Talk to your GP about the possibility of endometriosis. So, as you know, that painful periods is a very common condition that many women in their age of, like in their reproductive years, starting from menarche to menopause experience. Menarche means the start of menstruation and menopause means end of menstruation. During this period, which is like, let's say, anywhere between on an average anywhere between 12 to 13 years till 55 years, 50 to 55 years. This era of a woman's life, many women experience painful periods and there could be a plethora of causes behind it. But painful periods, always think about the possibility of endometriosis, especially when the pain is excruciating, when it is you are unable to bear it, when it is like excruciatingly painful periods. Always think about the possibility of endometriosis. What is endometriosis basically? As we know, that uterus has got three linings. One is the outermost lining, one is the middle lining or the muscular lining or the muscle of the uterus, and number third, which is the innermost lining, is called endometrium. So basically what happens is endometrium needs to only be in the inner lining of the uterus. That's all. This is where it should be. It should not be anywhere else. What is endometriosis? Endometriosis is a condition in which this lining or endometrial lining is outside the uterus. So let's say it's in the fallopian tubes that are connected to the uterus. It's in the ovaries, it's in the pouch of Douglas, it's on the bladder wall, it's on the bowel wall. Anywhere here, if endometrial tissue is there, that is called endometriosis. So basically, this is the definition of endometriosis: the presence of inner layer of uterus, the presence of inner lining of uterus, which is called endometrium, anywhere outside the uterus. So it could be anywhere, like, it doesn't have to be a specific place. It could be anywhere in the lower abdominal region. It can actually go up in the body as well. We have had the cases of thoracic endometriosis as well. But anywhere outside the body, especially where uterus is in the surrounding organs. Bladder and bowel are the two organs which is surrounding the uterus, and of course the fallopian tubes and the ovaries. Anywhere it's present outside the uterus, it's called endometriosis. And because it is present outside the uterus and it doesn't have to be there, its presence there causes pain. And it's actually more painful when you have periods, because periods is the time when you have these hormonal fluctuations present. And these hormonal fluctuations, especially estrogen, because estrogen is responsible for the hyperplasia or the growth of endometrial lining. And when estrogen surges or estrogen is more in the body, that's the time when this endometrial tissue outside the uterus gives you pain. And that is mostly during the periods time, but it could be on and off as well. But usually it's through when you have periods that is very painful, because the endometrial tissue surrounding the uterus being hyperactive because of estrogen, being hyperplaced because of estrogen, gives you pain. So this is basically the mechanism and this is the definition. Now you would ask that what's the cause of why does the endometrial tissue grow outside the uterus? Or why is it present outside the uterus in some women who experience this condition? The mechanism is not known exactly. Yes, there are some theories which we can discuss in my later podcast, but basically this is the reason, this is the definition, this is the pathophysiology, and then I will shed light onto, in my other podcasts I would shed light onto what are the theories of this endometrial tissue being present in other parts of the body apart from uterus. What part does estrogen play? What are the treatment options? And most importantly, how it is diagnosed and why it is so much underdiagnosed. Because I would just say one line in this podcast though. Women with endometriosis can have normal examination, even normal internal or pelvic ultrasound scan, but still there could be endometriosis, which is only going to be either diagnosed with a specialized ultrasound scans or with MRI pelvis or with laparoscopy. So endometriosis can have normal examination, can have normal ultrasound pelvis, internal ultrasound, but it still could be present. What are the other symptoms apart from painful periods that endometriosis can cause, especially including infertility? We will talk all about it in my next video podcast.